right, are we live yet? I think we're live. Trying to hit all the buttons just like I need to make sure we are on. All right, here we are. Nina says, is this a free event or do we have to join for $4.99 a month? Nina, if you're seeing me, it is free. It is free for everybody right now. I hope you guys can hear me. By the way, can you guys give me a check here? Give me a thumbs up or just say I can hear you. If you can hear me, I want to make sure my microphone is working. I can see comments here from YouTube. So here Kimberly says it's free, as she's right. Kimberly also says, hi, Dr. David, loving the live streams. Fantastic. Great. Y'all can see me and hear me just fine. Great. Fantastic. All right. So here's what we got today. I'm going to be hitting the weights here in just a minute. I have to do, actually, I'm going to start my calf raises here on, I like to do them right here on this, I don't know what this thing is. It's a machine where I have a ledge to do my calf raises. And I'm going to talk to you guys about the meniscus injuries real quick, just because I've had a lot of questions about that lately, and I wanted to just talk about it briefly, and then I'm going to answer any questions you guys have about meniscus problems and other things. If you have a question about knee arthritis or hip arthritis or sciatica or whatever you have, as long as I can answer it, I will do my best. Cindy gives me a thumbs up. Laz M says, hi, Doc. Happy Doctor's Day. I didn't know it was Doctor's Day. That's cool. I didn't even know that was a thing. Thank you. I appreciate it. Hi, Dr. David. Your video saved my life. Oh, I'm glad we helped you out, Jess Mia. Thank you for letting us know. I appreciate it. Love to hear those comments when we can actually help people out with avoiding a surgery or just getting out of pain, getting back to being active again. Steve gives me a peace sign. Nina says, so glad to be here. I'm glad you're here too, Nina. Anybody on Facebook? I got nothing but YouTubers here, people from YouTube. Michelle says, hi, Dr. David. We're also on Instagram. I cannot see your comments, though. And then Ademola says, my bro, thank you for helping me and believing in myself. You're welcome, Ademola. So happy for you. Knee is not locking. Well, that's great. Glad your knee is doing great. Ooh, Nina has a meniscus question. All right, let me talk about it real quick. I got carried away seeing all the hellos because I love to hear from you guys. All right, so meniscus problems. Let's just talk about it briefly. I want to give you like my take on it. Digging in right now. I am heavy in research mode, which, by the way, those of you guys who haven't yet gotten into artificial intelligence, like ChatGPT, all those things, oh my gosh. It is a massive research assistant. So I've been digging in there on, asking it to search the web for meniscus stuff. And it's so cool. It's really interesting how much information you can pull out so fast. It saves you like hours, if not days of researching time. And I'm kind of excited about this whole thing, with AI, but also a little sad that the research is still not that great. It's very focused on strengthening the quads and even the hamstrings on the thigh muscles, the muscles around the knee, in order to help a meniscus problem. And what I hear all the time from different sources over the web, and I know from colleagues and other medical professionals that I know, is that they're still recommending people get stronger quads. If you have a meniscus problem, they pretty much tell you, well, you're gonna need a surgery at some point, or try to strengthen your quads, stretch out your knee. Very vague answers onto how to fix a knee problem, like a meniscus tear. And they're leaving you with, it's just going to end up tearing worse and you're going to have arthritis one day. But here's what we know. There is some research showing that if you do have a meniscus surgery, like a meniscectomy, that's where they take a chunk out of the meniscus out, the part that's torn, that you're more likely to develop knee arthritis. They did a study in, I forgot which country in Europe, some European country, where they tracked people over time. They started out with the placebo study, meaning they had two groups of people, all of them had meniscus tears. One group of people got a traditional meniscus surgery where they cut out the meniscus, and the other group of people had a placebo surgery where they did an operation. They actually broke through their skin. They put them under anesthesia. They did everything except cut the meniscus. So nobody knew what kind of surgery they got when they woke up. They were just told that they were going to be in a study. What was crazy is 6 months later and even 12 months later, a year later, both groups improved the same in pain and function. So they're raising questions now. They're saying, well, do we even need to cut the meniscus out if it's torn? Is there maybe a certain population of people that have a certain type of meniscus tear that truly need the surgery, and we've been overdoing the surgery? They kept following up with those people, and they found that at 2 years after the surgery, the ones that got the meniscus removed, the real surgery, and even at 5 years, those that had the meniscus removed were more likely to develop knee osteoarthritis. Crazy, right? Because you would think that the surgery is helping you out with your meniscus problem, but here's my take on it. I think what's going on is they're taking out a piece of functional cartilage, even though it's torn and it looks like it shouldn't be torn on the MRI. It's still usable cartilage tissue that's helping your knee joint operate well. There are situations where people get locking, like Nina's talking about. Was that you, Nina? Somebody else was talking about the knee is locking. If you have knee locking, then I tell people you probably do need a knee replacement. I'm sorry, not a knee replacement, a knee surgery of some sort. There's things you could try first, but you need to get the root problem fixed first, because that depressurizes the knee, which can give your meniscus a chance to heal. Then see if you still need anything done after that. If you can get back to feeling great, no pain, or very little to no pain, very manageable pain, when you do overdo it kind of pain, and great function, like you could do just about anything you want, go up and down stairs, walk every day for your life, do exercise, then you don't need a surgery. Why would you go get a surgery in that case unless there's some crazy reason for you to do it? So those of you guys suffering with a meniscus tear, I just wanted to make sure you knew about that research. I'll have to link, I'll have to come back to this description on this video, because we're doing this live right now, and post it for you guys. So if you're catching this on the replay, hopefully you're seeing that. If you're here live with me, you're gonna have to come back and catch it when we post that research study. I have it, I just don't have it accessible right now. All right, with that, let's get to questions. So let me just talk to you guys real quick about how this works. I'm going to answer questions just down the line. From my screen here, I'm looking at my computer when I look this way. I see just a list of questions as they come in, comments and everything. And I can see if you're on YouTube and Facebook. If you're on Instagram, I can't see your comments or your questions. If you're on YouTube, you have the ability to do a super chat. That means you can pay a little bit of money and your question gets shot up to the top of my list. So I will answer that one first. No pressure, you don't have to do that. But if some of you guys want to get a question answered really fast, I will look for the super chats and make sure I answer you right away. All right, that being said, let's start with Nina. I already have her highlighted here. She says, I have a meniscus root tear and doctor says it will not heal and will hasten arthritis and eventually a total knee replacement. I'm so sorry to hear that, Nina. The root tears are a little more difficult. Here's how I would go about it though, Nina. Fixing the root muscle imbalance, as I was saying in my little teaching earlier, that's going to be key, because if you can get your glutes to work better, which is usually what leads to a meniscus tear, you can get your glutes to operate better, get them stronger, and if you feel like you're improving along the way, I think it's very possible that you can heal, that maybe it'll reattach, maybe it's not completely torn off. The meniscus has some ability to move around in the joint. That's how it's designed. That's how it's supposed to be. So if you have a root tear, then the assumption is that it becomes very loose and your knee can have some stability problems. So if I were you, I would test out getting into a knee brace, like one with brackets and hinges on the sides, and see if you feel better and if you can walk around better with that. If so, then work on the root muscle imbalance, keeping the knee brace as long as it takes, because they'll usually cut you off. Doctors will say something like, well, if it's not better in 2 months, if it's not better in 3 months, let's go ahead and do the procedure. But if you're making improvements in 2 or 3 months, and even if you're just 10% better, I think it's worth going a year and seeing if you keep making improvements. Until you plateau, I would keep working on glute strength, trying to not strengthen your quads because that's going to compress the knee joint, and then staying in the knee brace because you get stability and it gives your meniscus the best chance to heal, because there might be some stability problems with that. Now, a root tear, just for those of you guys that are watching and wondering, it's not a traditional meniscus tear. The meniscus attaches to the bone, the top of the shin bone, And so when we're talking about it detaching from the bone, that's like a root tear. Versus the more common tear is going to be on the rim of the meniscus in the inner part of the knee. That's your more typical tear, and those are very manageable for most people. You probably don't need a knee surgery like a meniscectomy. All right, I hope that helps there. Oh, we have a super chat. Let's go there next. Jess Mia's got a question. Hey, thanks so much for your contribution, Jess Mia. She says, I've been doing the 2 exercises for 2 weeks now for my tibial shift. How much longer should I keep them up? Thank you again for that life-changing video. You're welcome, Jess Mia. Yeah, that technique is such a big deal. I usually tell people just what she's talking about for the tibial shift is the shin bone and the thigh bone. They meet like this, right, where your knee bends, and the tibia is the shin bone. It can shift sideways. And I have a video where you can move it back into place. Something I teach my patients, or I'll do it for my patients. Usually it gets better within a week, sometimes even within a day. So if you feel like it's gone, like you've maxed out the benefit from that technique, then you can stop doing that technique and the exercise that follows up with it, the one where you're dragging your foot with your foot all the way turned in. And if you still have knee pain, it's probably related to fixing the root muscle imbalance of whatever your knee problem is. It might be a meniscus tear, arthritis, patellofemoral pain syndrome, whatever your knee problem is, you likely have a muscle imbalance that's setting up this tibial shift to happen. And the total pain, if you think of it as like a pie chart, a chunk of it might have been from the tibial shift. The remaining chunk's probably going to be from the muscle imbalance, and that's what needs to be worked on next. But I'll tell people, continue to work on that tibial shift correction until either the pain goes away, then you can stop. I'd say maybe just do it one more day for good measure. Or if you plateau, if the improvements are stopping, you did improve, but you're not improving anymore, and you still have some symptoms going on, then we need to look at what else is causing the problem so that we can fix that. I hope that helps you, Jess Mia. Great question. I feel like that happens to a lot of people. All right, let's go back to our list here. Thank you for that super chat, Jess Mia. All right, so we got Michelle Schaaf. Your program has helped me so much. Jay has been great. Jay is fantastic. I hope he's watching and sees this right now. I'll make sure he comes back and gets it. So yeah, I don't know which program you're in. If you can let us know, just for those of you guys that are wondering, we have a bunch of free videos on YouTube. This live stream is free. I'm trying to just give to you guys as much as possible. But for those of you guys that want to go deeper, I have some online programs. They're called recovery programs. And a lot of them are just videos of me talking and walking you through as if I was there with you for healing a rotator cuff or fixing a meniscus problem or whatever it might be. I have 8 or 9 programs. I don't remember off the top of my head. I have 2 programs though that I am paying a special attention to right now because we have some membership set up with them because they offer recurring coaching. So I'm in a small group with people on a Zoom call, me and my team every week, and some of them have one-on-one coaching depending on the setup. If you want to look into those, they're the knee arthritis recovery program and the hip arthritis recovery program. And we're trying to just grow this whole thing because people need it. People like you, Michelle, that are benefiting from it. I know you guys totally have the possibility to avoid surgery and avoid getting worse and living your best life, doing all the great things that you're here and you're supposed to be doing. And I feel like it's my job to help you do it. So glad that you let us know, Michelle. I appreciate it. Oh, we have another. I'll come back to you, Marianne. We have another super chat here. 2 of them. Shireen Weinstock, thank you so much, Shireen. I appreciate your contribution. If you have a question, I'm happy to answer it. I can't see it right here. Have another one here from Gennaro. Can't pronounce your last name, but thank you, Gennaro. I appreciate it. He or she says, what can I do to get back to playing tennis? Torn my lateral meniscus anterior horn. My right knee has grade 2 arthritis already. My left is grade 2 already. Oh, I'm so sorry to hear that. Gennaro, I'm so sorry that you're dealing with a meniscus tear and arthritis in both knees, and you want to get back to playing tennis. You got a bit of a road ahead of you. So if you have a meniscus tear, you said the anterior horn of the lateral meniscus, I'm not sure which side, and then you have arthritis in both knees, you have a muscle imbalance. Like, I don't know how to break it to you. You probably have weak glutes. You might have weakness in your foot muscles, and you need to get your glutes working better so that your quads aren't working so much and you can take pressure off the knee. It'll give your meniscus a chance to heal, and of course it'll take the pressure off your knee joint to prevent arthritis from progressing. At grade 2 arthritis, that's usually going off the Kellgren-Lawrence scale, which is like what doctors will tell you based on your x-ray, excuse me, they will, that means that it's like grade 1 is where it starts. Grade 2 is a little bit beyond mild. So you got like mild to moderate knee arthritis, very manageable. We have people going through our knee arthritis recovery program who have a grade 4 knee arthritis. We just saw somebody today, I was reviewing the video, who said that they were going to get a knee replacement. They had to cancel it because they were feeling so much better. So probably grade 4 knee arthritis, and you're at grade 2. So you just have to go work on fixing that muscle imbalance. I would start with getting your glutes more active. So make sure that they can activate, because if they can't activate, nothing you do is going to give you real long-lasting progress. You might do some leg exercises that help you in the short term, but you have to get your glutes to be active apart from your thigh muscles, and then glutes need to be active left from right. You need to be able to clench one side without the other side wanting to clench too. Then you can start to strengthen your glutes properly in normal glute exercises. You have to do it that way. Then once you can strengthen your glutes with like weights and you can do it with walking too, you should be feeling tremendously better at that point, and you'll be ready to start looking at doing tennis. We have people in our group that are doing tennis and pickleball, and I have to tell them, put the brakes on until you get the glutes going right. Once your glutes are going right, then you can confidently go into those dynamic sports, those racket sports, and you'll be able to do better at that point. So put the brakes on for just a bit, Gennaro, and then come back to tennis once you're stronger in your glutes and you know you can activate them well. Hope that helps you out there. All right, who we at next? Shireen Weinstock says, Dr. David, thank you for your invaluable videos. I have spasms in my right hip flexors and stiff right knee, and I have followed your videos about strengthening glutes. Fantastic. I'm glad that you've been benefiting. Sorry about the spasms. The spasms will happen when a lot of people think that it's related to like electrolyte imbalances, like you didn't have enough potassium or sodium or something like that. So people will start drinking like pickle juice, eating bananas because they're trying to increase their electrolytes, drinking Gatorade, that kind of thing too. When you have spasms related to electrolyte imbalances, you usually will get spasms and cramps all over your body because it affects your whole body. But if you have it in a specific muscle, it's usually related to those muscles being weak and being overworked in a bout of exercise or movement, or a nerve problem. So in your case, given that you've had these issues you're talking about with the stiffness in the right knee, you probably have a muscle imbalance, and those hip flexors are overworking. You're using them when you shouldn't be. It's a compensation that happens. Get those glutes stronger like you're already doing, and you'll get better and better. All right, I'm trying to get to my deadlifts here. Can't help but answer more questions. Dr. House says, I have an ACL sprain without a tear. Good, that's more manageable. But another problem happened to me, which is patellofemoral syndrome. What do you advise me? Quadriceps over glutes only? Great question, great question. Let's talk about that one while I do some deadlifts. Let me get a better angle for you guys here so I can move and talk. Oh, I'll get my clips on in a minute. It's lightweight. So for an ACL sprain and patellofemoral pain syndrome in the front of your knee, you need to make sure that you're in a knee brace, because the ACL is a ligament that is very important for stabilizing the knee joints. Your knee joint is relying on that ACL so that your knee isn't wobbling so much when you're walking, because it's going to make small wobbles as you change directions and walking and just doing your everyday tasks. And then, of course, if you get into harder tasks like exercise, it's going to activate even more. So get a knee brace, like one with hinges. You don't want to just get a sleeve want to get a legitimate brace, which you can get at any sporting goods store. You can definitely order one online, and one with hinges and brackets on the sides. And you should feel better, like immediately in that brace. Once you have that brace on, as long as you feel like you can walk and do all your normal activities, resume. If you feel like you need to back off, then back off. Only do what doesn't hurt you. And then, yeah, you need to work on your glutes and not work on your quads. Because if you're working on your quads a lot, it's going to promote your leg moving in a direction because of the compensation. When you use your quads a lot, it makes you want to turn your leg in and bend with your knees in, and that adds more tension to your ACL. So if you're more quad dominant, then it holds, when you activate the quads, it positions your knee outwards more, which takes tension off the ACL, puts slack on the ACL, which gives it a better chance to heal. That in combination with the knee brace is what's going to help you heal so that you don't develop a tear and you don't have any more knee problems moving forward. Now, also, not strengthening your quads, working on the glutes, takes tension off the front of the knee, which will help with the patellofemoral pain syndrome, or chondromalacia. They're both almost the same thing, just chondromalacia has positive x-ray findings. I hope that helps. All right, do we have any super chats coming in? Not right now. Let's keep going down the list then. Who's next? All right, I have Tom Bigger. We hear PRP works best overall, the rest injections for damaged meniscus. So you're saying PRP is best over all the rest of injections for damage. Okay, so you're saying that the PRP injections are best for damaged meniscus, is what you're telling me, Tom. I can't tell you with certainty. I'm gonna do my sit-ups. Can't tell you with certainty that PRP injections or stem cell injections or cortisone injections, anything like that, it's not going to work for everyone. You have to figure out what works for you. But even with PRP, which for those of you that don't know, that means platelet-rich plasma, they have to draw some of your blood, spin it in a centrifuge, and they separate the platelets from the rest of the stuff in the blood. They inject the platelets back into your knee, in the meniscus, and that's supposed to help you heal more. There's some people that it works for them, and there's some people that say it didn't make a difference. What I say is, I'm not against it. Go ahead and give it a shot. If you want to try it, you just should consider that you have a muscle imbalance. Especially if you had a meniscus tear that happened like gradually over time, like there wasn't a single accident. And I would even argue that if you had an accident, you probably had bad pressures leading up to that accident that set it up to be vulnerable during the accident. But a lot of people just get like nagging knee pain that just gets worse and worse over the years. Maybe they exercise, and then one day they go get it checked out and there's a tear. If you have that kind of situation, then you have a muscle imbalance and you've been overpressurizing your meniscus. And if you go get the PRP injections, you're still going to have bad pressures going through your knee joint, and it's going to set up the PRP injections to be ineffective. Maybe there'll be short-term relief, but you won't get long-term relief from the PRP injections because you still have bad pressures going through that knee joint. I hope that helps. All right, let me read the next question while we get some more weights loaded. We have Nagendra Subarao. Nagendra says, knee bends a little while walking after removal of K-wires put while operating patella bone fracture. So it sounds like you had wires put into your kneecap, and because you broke the kneecap, and now your knee's having trouble bending. All right, so if you have trouble bending your knee after a knee fracture and a surgery, that's a situation where you need to be working with the doctor. If the doctor sends you to physical therapy, you need to be working with them. If you're working with me, I would say we need to force some motion to happen within reason, without causing any sort of bad inflammation, but it might be painful. I don't tell people to move into pain except after having surgery because of stuff like this. Because your anatomy may have changed, the shape of your bone may have changed. You may have not been moving a lot while healing from the fracture. Like you might have been immobilized. That's typical. And now it's time to move. If the doctor cleared you and they said it's time to move, you kind of need to move, and it might hurt to move into ranges of motion that you haven't moved. Your cartilage isn't going to like it, but you have to gradually move in those directions and get the motion available. And in some cases, the motion is not going to be the same afterwards because of some permanent changes to the bones while you had the wires put in there and while you were immobilized. It was just a result of the bone fracture. So get moving. You got to start bending that knee, Nagendra. You got to start moving that knee joint, and it would be best if you did it with the supervision of somebody, a healthcare professional, just so they can help you out. Oh, we have another super chat here. BB, thank you so much for your contribution, BB. Let me take a good look here. I heard popping in knee when stretching a couple months ago. Now every time I exercise, simply clean my house, I have knee pain. What do I do? Is it a tear? Great question, BB. So just to reiterate, you hear popping. You heard popping a couple months ago when exercising, and now you just feel pain whenever you're doing exercise or just cleaning your house. Is it a tear? It's hard to say. It might be. It might not be. It could just be like a tibial shift, like what I was talking about earlier, where the bones shifting each other, an alignment issue in the knee. That's very, very common, and it can feel like something's wrong with your knee because it is. There's an alignment problem, and it may not be a tear. It could set up a tear if you don't address it. But I want you to go check out our video. I think it's called "How to Fix Inner Knee Pain in 2 Minutes." If any admins are on, if anyone on my team is watching, if you can reach out to BB and just comment that video, you know which video I'm talking about. And if BB, if you don't get it commented, it's easy to find. It's our top viewed video because it works. You probably have a tibial shift. You need to just go fix it, and you'll probably feel a lot better with cleaning and doing exercise. You might need to work on it for a day, maybe a few days, probably not a week, not more than a week. And then if there's any muscle imbalances you need to address, you should be addressing those anyway. Get stronger in those glutes, but you should be ready to do it. You shouldn't feel pain when you're exercising. But that's common. You might feel a pop while just doing some weird thing. Those tibial shifts, they happen at strange times. It happens to me, by the way. Because I know what it is, I'll be coming to the gym sometimes and I feel my knees not in good alignment. I have a shift, and I'll take the time to fix it, and I'll be over it in a day or less, and I'll be able to exercise. And sometimes, let me show you this quick trick. I've never shown anybody this, but you can just shake your legs sometimes like that. Like I'm just kind of kicking, doing the stanky leg, and that movement kind of jostles your knee joint into right alignment. I'm not guaranteeing that's going to work. It's a very non-specific way to do it, but I have done it myself and it works. Not consistently. It's way more focused if you put your hands in the right spot like I show in that video. So go check out that video, BB. We have another super chat. Thank you, Frank. Let's read your question here. Hi, Doc. I was diagnosed with inner meniscus tear, parrot bite. So there's a type of meniscus tear called the parrot beak tear. After MRI at today, the age of 50, how are the chances to fix this without surgery? Thanks. Oh, Frank, fantastic. So let me just say this. Let me say this succinctly for everybody. So Frank, you're asking what are the chances of your meniscus tear healing, given that you're over 50 and you had a parrot beak meniscus tear? How can you fix this without surgery? The chances of you fixing this are super high. I mean, in the 90s of percentage-wise. So 95, I'd say even 98%. You have to fix that muscle imbalance. So if you don't address the muscle imbalance, Frank, you're going to continue squashing the meniscus and further tear the meniscus. You have to take the pressure off to give it a chance to heal. It commonly will give you pain on the inside of the knee. That's so common. And the tibial shift that I've been talking about could be a factor here. You might go look at that video as well. But I have a whole program I've built on this. It's called the Knee Meniscus Recovery Program, and it works. I cover that tibial shift correction in there, and then the whole process that I walk my patients through in person of strengthening the right muscles, getting the glutes to activate, making sure that they're safely moving into the more advanced exercises. We start with just walking first, and then eventually weight room exercises, and then adding weights and getting all the way back to doing everything you need to. Fixing the meniscus problem this way is, in my opinion, the absolute best way to do it, so that you have long-term knee pain relief, so that you're decreasing the chances that you're going to develop knee arthritis later, because that's the worry. If you don't address this now, which a lot of people don't, they just kind of wait and see what's going to happen, or they'll take some pain medication, try PRP injections, and oftentimes they're following doctor's orders. The doctor told them to do all this stuff, but it's not enough. It's just pain relief stuff, pain management stuff. It's not fixing the root problem. But if you fix the root problem, then you're going to be best off for the long term. Not fixing the root problem and just doing the short-term pain relief stuff like pain medications, injections, random stretching, random exercises, you're going to increase the chances that you're going to have knee arthritis later, because you're squashing your knee joints. That's why you tore in that meniscus. Go work on it, Frank. Go start fixing that muscle imbalance. All right, y'all are keeping me off my exercises with these questions. Let me come back. Where was I? Here we are. Tilly 579 says, I purchased your hip program and it's great. Thank you. I was told to have surgery, but this is working. Yes. I love it, Tilly. Thanks for telling us. I love it. Those make my day. I mean, doesn't get any better than that. You thought you needed surgery. The doctor thought you needed surgery, and you found out how to fix the root problem, and you're getting better, and you're fixing it for the long term. Best of luck to you, Tilly. I hope you heal 100% and get back to doing everything you love. Awesome. Oh, made my day right there. Prakash, my meniscus is not paining, but still I feel like it's not completely healed and I have some discomfort. Well, that's good. I'm glad that it's not hurting. Yeah, you won't feel 100%. That means there's still stuff going on. What you're feeling probably, Prakash, is the increased pressure through your knee joint because of the muscle imbalance. It's not quite pain, but you feel off. There might be an alignment issue, like that tibial shift problem that I was describing. But I know that feeling, like where the knee just feels off. That what it is just a low level of irritation, not enough to cross that threshold of, ooh, it hurts, that's pain. But you feel some pressure in there. That is the muscle imbalance talking to you right then and there. So make sure that you fix that muscle imbalance, Prakash. You might look into our knee meniscus recovery program. That's a surefire way to just get all the steps lined up nice and neat. We have tons of videos on YouTube. Go check that out, and I'm happy to answer any more specific questions you have here as well. Kimberly. Hey, Kimberly. Trying to straighten my glutes, but my knee is so weak. Always appreciate your help. Trying to strengthen your glutes, but your knee is so weak. Yeah, that happens a lot. So sorry. Keep going. You gotta just keep going. Something that I don't talk about a lot, Kimberly, is, I talk about not strengthening your quads. And people want to go strengthen their quads because they feel weakness in their glutes. I'm sorry, they feel weakness in their knees. They feel like they have weak knees. But you will strengthen your quads and your knees will feel stronger the more glute strength you get. When I talk about doing glute strength exercises, like I'm going to go do some deadlifts right now, I'm using my quads to do that. But I'm thinking about using my glutes more than anything. I want my glutes to get most tired. But I'm feeling my calf muscles working. I'm feeling my foot muscles working. My quads and my hamstrings are absolutely working back. It's a total body workout. My grip is being worked on. My shoulders to some degree, I'm not pushing up overhead, but they're tensioning up in order to pull heavier and heavier weights. So you can't ever escape completely not working out a muscle group as you advance, as you get healthier and stronger and you do more exercises, which is what I encourage people to do. But in the beginning, when you're fixing the muscle imbalance, you do have to focus on the right muscles, and you should not be strengthening your quads. My strong opinion, you shouldn't be strengthening your quads if you're recovering from a knee problem or a hip problem. All right, let's get into another super chat we have here. Who's here? Cindy Stuff says, thank you, Cindy. I appreciate your contribution. Thank you so much. I've been using your sciatic glute exercises. Does it make sense? I'm sore because of it. How long will it take to help with severe pain in cold or heat for pain? Okay, so Cindy's been doing some glute exercises related to her sciatica problem, and she's sore. Yes, you will feel muscle soreness from that. You could be feeling some nerve soreness because it's a nerve problem. The sciatic nerve might become a little irritated. That happens. What you should track, though, is some sort of improvement, either in pain or function. With sciatica, because it's a nerve problem, you don't always get an improvement in pain right away. Just note that. But if you feel like you can do more with the same level of pain, that's a win. If you can walk a little farther, if you can stand a little bit longer, even though it hurts kind of the same, that's a huge win. Pain relief is coming. Keep going with what you're doing. And glute strengthening, if you have a sciatica problem, is critical. So you're on the right track, Cindy. Good job. And then you're asking, how long will it take to help with severe pain in cold or heat for pain? The more severe the problem, longer it takes. I can't tell you specifics on how long it's going to take as far as this many months or this many weeks. I'll give you some ranges though. I have helped people with sciatica and they've gotten completely better within a couple of weeks. They just had some major shifts, didn't have severe symptoms, didn't have severe muscle imbalances, minor muscle imbalances. And then there's been some people that have taken 6 months plus, and we've just been having to peel away the layers of the onion. I fix one thing and then find the next thing to fix. We fix one muscle imbalance, there's another muscle imbalance. We move some joints that were stuck, and there's even more joints that we find stuck. There's just many problems stacked on top of each other. That's why sciatica is so complex, because it spans from your back to your hip to your knee to your foot. It can go all the way down to your foot. Some people have that. You know what I'm talking about, when you get those cramps in the arch of your foot on the side that you have sciatica, or in your calf muscle, and you didn't even think it was related. It's related. And we need to look at the foot in order to fix that sciatica problem. People think they have plantar fasciitis, and it's really sciatica. Some people don't even have back pain or hip pain, and they don't think they have sciatica. They actually have they think they have plantar fasciitis, but they don't have plantar fasciitis. They actually have a sciatica problem presenting as heel pain. Get that all the time. We get referrals from doctors that say plantar fasciitis, fix them. And 9 out of 10 times, it is not plantar fasciitis. It is sciatica in the foot, and we're looking at fixing the hip and the back and the knee, and that fixes their heel. We still address the foot too. So as far as heat or cold, it's up to you. There's no right or wrong. You got to experiment with both and see which one gives you most relief. And it might be that neither give you most relief. What I have seen happen, give people a little more relief, is warmth, like an electric blanket or like a hot water bottle. Those rubber things you pour hot water into and cap them, you seal it, and they'll lie down with that on their hip or on their side. But some people do prefer cold. Some people prefer I've seen people do cold plunges, like an ice bath, for sciatica, and just because they're trying to get a shock to their system. And I think that's a good idea. A sauna might help as well, like getting in a really hot room. Some people prefer moist heat or dry heat, but all that stuff's short term. You still have to work on those glutes. So good job doing the glute stuff, Cindy. All right, who's next over here? We're almost done. I've only done one round of things, guys. You don't let me exercise. It's okay. I'm here to answer questions. Let me get oriented here again. This always throws me off where I am. Okay, here we are. Nagendra says knee straightening right leg is required. Oh, so Nagendra, you're the guy that had the kneecap, the patella fracture, and you had the wires pulled out. So yeah, you need to straighten that leg. You need to go push it, like literally push your knee straight so that you get it as straight as possible. Especially if you just had the rods or the wires pulled out, now's the time to go. I would push as much as you can tolerate without being in too much pain. And remember, I'm not telling him to push into pain because that's something that I tell everybody. He just had a surgery done and a fracture, a broken bone in his knee. So he needs to do this right now. But if you have a non-surgical problem, like you have a meniscus tear that hasn't been operated or knee arthritis that hasn't been recently operated, you shouldn't be doing things that hurt. All right, Lorraine is here. She says, I had the surgery and still in pain. Yeah. Happens a lot, Lorraine. Because the muscle imbalance is still there. Let me get I should have been doing heel raises this whole time. The muscle imbalance is still there, Lorraine. So the surgery didn't fix that. And it happens so many times that the surgeons think that the tear or the arthritis or the impinged thing is the thing that is causing you the pain. And we're finding out in the research that that's not true. It's not always true. It might be, but if you had a procedure done, you heal from it afterwards, and you still have the same pain, then the surgery didn't fix you, and there's probably a muscle imbalance there that you can still fix. So that's the good news. The bad news I'm sure you're thinking about is, damn it, I had a surgery that I probably didn't need. And that sucks. But the good news, you always got to look at the bright side, is a muscle imbalance is probably what's causing your pain, and that's fixable. Go fix a muscle imbalance. You're probably going to feel a lot better, and maybe even completely fine, even though you had the surgery. I hope that's the case for you. Do you have any super chats? No, we got them all. Cindy's stuff was the last one. All right, we got Chris Chambers here next. Chris says, hi and thank you. We might be done. What might be done when there is a small meniscus tear and also cartilage damage, grade 4, in the same leg, but sometimes knee just buckles. Sharp pain in top of the shin bone in muscle. That one's a tough one. When you get that buckling, let me answer that while I lift my weights here. When you get buckling in your shin, in your knee, and locking in the joint, and if you had grade 4, well, you said small meniscus tear, but the grade 4 cartilage damage, that's like end stage arthritis typically. That's a situation where you might need surgery. I would still, so if you were here in the clinic, I would be telling you, let's give this a shot if you're willing. If you want to try to heal with this, from this problem without surgery, I would be telling you, let's set up some treatments, come on in. Or if you're going to join our knee arthritis recovery program, like if we were on the phone talking about it, I'd be telling you, Chris, let's give this a good shot, because it's not going to hurt you to try it. You can always get the surgery. It's not, surgeon isn't going to be like, this is urgent. It's not a life or death situation. It's just your mobility is going to be impaired for a while. And so you have to be willing to tolerate that. But if you can fix the muscle imbalance by getting the glutes active, because if you can't right now, which I'm betting you probably can't, so you can't even activate your glutes, or if you can, your thigh muscles also activate along with your glutes, and you can't activate your glutes apart from each other, then fix that first. And very often, people will start to feel the glutes already. When their glutes start working better, they start to feel better in their knees already. And then you start to incorporate that in, and you start to feel tremendously better. So I would fix that first, even though you have grade 4 cartilage damage in your knee and a meniscus tear, because we see people do it all the time. They don't have a surgery when they were told they should have a surgery, and they have buckling. And I warn them, just like I'm warning you, that you might need a surgery, but depending on your willingness, depending on your situation, you might be able to get away with it. I hope that helps. All right, who's next here? Gendra, more weight falls on right leg, toes, toe curls, and pain while walking. Knee was operated and K-wires removed. Leg weakness increased after K-wires removed. Oh, damn. He's telling us more stories about his kneecap that was repaired from the fracture. So you're saying that you step on the right more and toe curls hurt while walking, and leg weakness increased after the wires are removed. Yeah, so it's common to have more pain after wires or rods are removed because you kind of had a little surgery. You're going to have inflammation whenever they remove something out of your body surgically, even though it was probably a much less invasive surgery than the surgery that you went through to put those things in. Right after, it's going to be a little weak. So like I said, now is the time to start moving and start using the leg. Whenever I have somebody who's post-operative, I literally tell them these words. I say, you need to do as much as you can within your tolerance. So if you feel like you're going to shed a tear, that's probably the stopping point. Like, you're going to have pain, but if you feel like you want to start to cry, I mean, I'm being silly. I don't mean to like offend you if you're not the crying type. I just literally mean, like, if you wince, if you maybe you do feel like you're going to shed a tear, that's probably the stopping point. But you also can't do so little that it doesn't hurt. After a surgery like that, you need to move, and you need to move into some pain probably. Just do what you can tolerate. And then the next day, you shouldn't feel like you have effects from the day before. That's another key thing. So like if you push yourself and then the next day you're sore, you did too much the day before. So maybe you're really tough and you're like, it takes a lot for me to shed a tear. All right, next question here, Michelle. I wish I had a rewind button. I would have never had surgery. I know, Michelle. You have no idea how many people I talk to that tell me that, after they learn my stuff, that they're like, did I really need surgery? Hey, but the good thing is, like I said to someone else earlier, you can still fix it. The muscle imbalance can be fixed. Hopefully you didn't have any, severe, long-lasting effects from the surgery, as a result of the surgery. So that does happen sometimes, or, some complication from the surgery. But even then, you can still get better. I made a program called the Failed Knee Replacement Recovery Program because there was so many people that we were talking to that had a knee replacement already, and they considered it a failure. They were still having the same pain, sometimes worse pain afterwards. Sometimes it was better than before they had the surgery, but they still had pain. And so they're disappointed. They're discontent with it. And there's muscle imbalances to still fix. And a lot of those people, they get 100% pain relief. Yeah, they can't do everything they used to before because they have a knee replacement now, but not having pain makes life so much better. All right, who's next here? I got time for like one, maybe two more questions. If anybody has a super chat, now is the time to get it in because I'm going to log off soon here. Vivian. Hey, Vivian. MRI shows fraud meniscus. I have not heard of that one, a fraud meniscus. I tried getting legs stronger, but my knee doesn't bend well. I cannot straighten it. Any suggestions? Frayed meniscus is what you mean. MRI shows frayed meniscus. I tried getting the legs stronger, but my knee doesn't bend well. I cannot straighten it. Any suggestions? You can still get your glutes stronger despite your knee not straightening out all the way. I have had clients that I've helped in person who have a frayed meniscus like yours. Frayed just means like it's not a clean tear. So like if you think of that as the tear, it's more like frayed. It's like shredded. I have had clients with a shredded meniscus, a frayed meniscus, still improve to the point where they have no pain. The first one that comes to mind that I helped that way, I didn't know. So he came into my office, knee was so swollen, it was painful. He was hobbling. He wasn't in that much pain relatively. He seemed like a tougher guy. And he had just come from an MRI appointment, but he didn't have the results yet. He said he was going to go to that visit next week. I said, let's proceed. Let me see how much motion I can get out of your knee. I did all my hands-on stuff, got him more motion, taught him the exercises, got his glutes going. The next week he comes in and he had just had the appointment with the doctor where they went over the MRI results, and he wasn't limping anymore. He was walking fantastic coming in. His knee wasn't straight all the way like yours, but he said, my pain's gone. But then he showed me the results from the MRI, and he said the doctor said it's the worst MRI he's ever seen, that it looks like it exploded pretty much. And I looked at the results myself and I said, yep, it's the worst MRI I've seen too. And this looks like an exploded MRI, an exploded meniscus as well. But he was like, well, I don't want to get a surgery because I'm feeling good right now. And I said, well, then don't do it. We're just on visit 2 anyway. We haven't even started visit 2. He had just showed up. We went through 3 or 4 months of care. He got back to jogging, light jogging. I had to pull the reins in with him and tell him, just hold on, let it heal a bit more. But he was so eager to do everything because he was feeling so good. He was swimming. He was walking as much as he wanted. He was still working and had a very active job. He had to be on his feet all the time. And he did just fine. So Vivian, I think you could do the same, even if your knee doesn't straighten out. And that was the point. He never straightened his knee out. He always had a little bit of a bend. And his walk was just a little off, not that noticeable. I noticed because I see that kind of stuff. I have an eye for that. But his walk wasn't terrible. And he could jog, actually. When you jog, you don't fully straighten out your knee all the way. So you can do it. As long as you have as long as you don't have a big loss of motion, you should be able to be just fine without surgery. But you do have to fix that root muscle imbalance. I would highly recommend you go check out our knee meniscus recovery program, Vivian, because it will clear up a lot of things for you. It'll give you a clear path on what you need to do. It just makes everything straightforward. But go check out our playlist on YouTube as well, the knee meniscus help playlist, and there's tons of great information there for you to get going on as well. All right, guys, I got time for one more question. Oh, somebody snuck in a super chat right as we're ending here. Last question, the Mighty Bull. Thank you so much, Mighty Bull. I remember you. I think you were on here last time. Does losing weight help knee arthritis? Great question, Mighty Bull. The short answer is yes, losing weight helps knee arthritis. The long answer is it doesn't improve that much for everybody. Some people, the more weight you have, the more important it is to lose it. What I tell people is if you're like 20, 30 pounds overweight, depending on your size, because if you're a taller person, I'm over 6 feet tall, I can add probably 40 pounds and my body can still carry it around without that big of a problem. But if I was 5 foot nothing, adding 40 pounds to my body weight proportionally is a lot. So your height matters. But what I tell people is if you're like in the range of 20 to 40 pounds overweight, depending on your size, you may not need to focus on the weight. And it's relieving to people because they often get told by their doctor, when they show up with knee arthritis or hip arthritis or a meniscus tear, you need to lose weight. Or sciatica too, like, hey, you're 20 pounds overweight, you should lose weight. It's easy for the doctor to say that, right? They just weighed you, they took your BMI, maybe you're on a blood pressure medication or a cholesterol medication and you need to lose weight for other reasons, so they keep pushing the weight thing. But then for you as a patient, you're like, well, I would love to lose weight, but I can't freaking walk. My hip hurts and my knee hurts and I can't bike and I can't do stuff because I'm in pain. So it's like a vicious cycle where you want to lose weight, but you can't lose weight, and you're told that losing weight is going to help your pain, but every time you go to try to lose weight, it hurts your pain more. And so so I tell people, just if you're not that overweight, of course, put down the fork, please, stop eating so much. You got to worry about that end of it too. But I get the exercise part of it, and you can't exercise right now because you're in pain. Go focus on the muscle imbalance first. Fix your glutes, fix your foot muscles, get the pressure off your hip joint, off your knee joints, so that your knee arthritis can calm down. And you'll be surprised. In as little as a month, you might be like, you know what, I can walk now, and I can go start burning an extra 100, 200, 300 calories a day, and then target the weight better. But you have to make that decision yourself. You have to work out in your situation, whether it's more important for you to lose weight right now or work on the muscle imbalance. And for most people that I talk to, they have to work on the muscle imbalance first. You can gain strength much quicker and much easier, small amounts of strength in a shorter amount of time than what it takes for most people to lose weight. Let me say that again differently. You can exercise for a week and gain more strength, enough to make a difference in your pain, in your knee pain, rather than going through the effort that it takes to shed 1 or 2 pounds in a week. It's not going to make as much of a difference if you're lower in weight. Now, if you have a lot of weight to lose, like you're 100 pounds overweight, losing 20 pounds isn't out of the question to do within, a couple of months, and it could make a big difference in your pain. So I hope that helps you out, Mighty Bull. Hey guys, thanks so much for joining me. I'll be here next week, probably with Jay and Raul. We might have another guest. One of our other employees might come out and get a little workout in. And I'll be answering questions along with Jay and Raul. Thursdays is what we're looking at doing here. If you have questions, you can, we'll schedule this probably within a day. Maybe this one got scheduled a couple hours before. You can start typing them in early and start dropping your questions in there. And guys, thank you so much. Love you all. Thank you all for being here. Bye-bye.